Good afternoon, everyone. I would like to share with you the glimpse of my diary. This I had written in year 2023, and as you can see, I had written TED Talk, July 2023, and the action task manifestation. So I truly believe that coincidence is not coincidental. We think of something, we dream of it, we start acting upon it, and then the entire universe works upon it for us to have it. So I am Dr. Shilpi Mohan, and I'm a cardiologist, a holistic healer, and a clairvoyant, and a columnist painter married to an army officer with an unconventional love story akin to the movie Two States. I am born in a middle class family, and I derived the lessons of spirituality and discipline from my mother, and honesty, integrity, and perseverance from my father. My father is still my role model. He was awarded by the president for excellence in his work, and whatever I am, the fabric is his. I have a college bestie who had always been with me in the thick and thins, and I would not have been here without her. And I am married to an army officer who was my school buddy and who has provided me unwavering support in whatever I have done. And many of the times my career pursuit seems very weird to him, but he always gave me support, which was very, very important for me. He always told me, "You're born to be big, and I am no one to stop you. I will always be the wing beneath your wings." So I am telling this because I express my heartfelt gratitude to them. Early in my childhood, I decided that I want to be a doctor. Then I thought that I have to be a cardiologist. And in the year 1993, I cleared my engineering and medical test together. That created some buzz in the town because that time I was in a small town, Bilaspur. So I could clear both the exams. And as I was going in the journey to become a cardiologist, midway I decided that I should get married to my friend, my school friend. And I thought that I will clear my pre-PG entrance and then only I will reveal to my father that I want to do so. Because we belong to a conservative family and this was not acceptable. We had a lot of sacrifice. We were not in talking terms for a year so that I could prepare for the exam, and I cleared my pre-PG entrance in the first attempt. And at that opportune moment, I decided that I will reveal this to my father. Needless to say, it shattered his dream, because he always wanted me to be in a place, to have a setup and have my own practice. And getting married to an army officer was something very, very difficult. And rightfully, he mentioned to me all the difficulties that would have come to my life, like getting posted to different places, different culture. He was from South, I was from North, so different customs. And my profession wanted that I should stay in a place, and his profession always wanted us to move around. But at that age, whether the head wins over the heart or the head wins over the head, this is a question which has got an obvious answer. I was reckless. I went ahead and decided that I would marry him, and I became an army officer's wife. Needless to say, the journey has been a roller coaster ride since then. We had frequent postings. We had 8 years of separation just after the marriage because I wanted to complete my post-graduation. My professors thought that I would leave everything in between, but I completed my post-graduation, as well as I would say the luck, I can say that it was luck, that he got posted to a field area, and then again I got a chance to do my super specialization in cardiology in Army Hospital Research and Referral. So this brings to my second core belief, that always listen to your heart, because even though it is on your left side, it always tells you right. When I was at that crossroads to decide whether I should listen to my parents or get married or follow my heart, I always remembered one line. जान आगाज पर निसार चले, हमने अंजामे सफर कब सोचा है. And in the hindsight, I would say that decision gave me the chance to do cardiology in Army Hospital Research and Referral. Had I not married him, I would not have got this opportunity to be associated with that prestigious institution. In our initial 8 years of marriage, when we had stayed separate, we couldn't even start the family, which is, as you can understand, very, very difficult to explain to the society, because have an early child and all those things, they always play a role. But for 8 years, we just had a lot of commitments and sacrifices, and I had my first conception at the age of 34 and next one at the age of 42. Not only I ensured that I cleared the exam, he was also doing well in his career, and because of that he cleared his exam. And believe you me, there is a lot to study even in army. We feel that we have a lot to study here outside, but there is a lot to do in army as well. So he cleared his exam, and government gave him a chance to do a prestigious course in Canadian Staff College. And as a corollary, I got an opportunity to do observership at different hospitals, being in Toronto. After that, he went to different places and I followed him. Wherever I went, I made a point that I would work in big or small hospitals, whichever place I got. And that increased my patient base and increased my experience. After that, we came to Secunderabad. And Secunderabad was one place which I really liked. I am from Bikaner, he is from Bangalore, but I am Hyderabadi at heart. I thought that this is the right place, and I was always ambitious, so I thought that I will set up my center here, and I started working for it. Started looking for some venture capitalists for a holistic health center, but that being not a very profitable venture, I didn't get many encouraging results. So I thought that I would start small and take a big leap. And with this, I started my own setup and enabled everything like clinic software and everything. The day I decided that I will start the center, the same day he came back from the office and told me that he has got an interview call for a diplomatic assignment and he has to report in 10 days. So life always has a twist. Now I was about to start my own setup. I had a dream which had not even seen the light of the day. On the other hand, there was a promise of seeing the life of a diplomat and all the experience I would have if I go with him. Needless to say, he cleared the interview. And later I realized that I had to join him because of the criticalities associated with his profession. So in December, in a snowy, chilly night, we reached Bishkek, which is the capital city of Kyrgyzstan, also known as Switzerland of Central Asia. I thought hospitals are everywhere, no problem. I would join some of the other setup, and meanwhile, because the distance is 3.5 hours, I would keep on coming in between and continue with my practice. But because there are medical legal hassles associated with my profession and the criticalities associated with him being a diplomat, and the language barrier, I was not much encouraged to do so. Meanwhile, I continued to learn, I did yoga training course, and then tried to upgrade my skills, started learning and venturing into crystal healing, tarot card reading, and started learning whatever I could through online modalities. Soon I decided that I'm not able to practice here, I would move back. Again, there was a twist. COVID set in. And we were all in a lockdown situation and not knowing what is going to happen next. But the fortunate part was, during that time, telemedicine came into vogue. And as I had worked at different setups, different hospitals, I was invited to join telemedicine platform. And India and Bishkek time difference is only 30 minutes. Had he gone to any other country, I would not have got this opportunity to do telemedicine practice so seamlessly. So during the COVID time, I could treat my patients online without any difficulty, giving them minute-to-minute treatment in the hours of need when they needed it the most. And that was such a satisfying experience for me. As you can see, these patients, they were with me offline, and then there were so many patients who got connected to me online. There were many of them whom I never met for 3.5 years. When I came back, then I met them. But this extended my Ashvattha Cardiac family and increased my patient base, and I could do whatever was close to my heart. So this brings me to my fourth core belief: know your Ikigai. What keeps you moving? That activity that gives you meaning to your life, and find out your reason for waking up in the morning. I was a cardiologist and I had been practicing cardiology for more than a decade, but I was not an interventional cardiologist at core. I got fellowship program, I cleared the exam and got fellowship in Narayana Hridayalaya, but after 3 months I left it. Because deep inside I always felt that prevention is better than cure. And during COVID times, my beliefs were further strengthened because the focus shifted from treatment or treatment to prevention. I started working upon it, but that void was always there inside me, that am I just to be a doctor? First I thought I had to be a doctor, I went ahead. Then I thought I want to be a cardiologist, I went ahead. But still that void was inside me, that why have I come to this earth? With that, I started delving into the alternative healing practices, learned tarot card reading, crystal healing, and chakra healing, and various other alternative healing practices. As with faith, I can tell you that whatever treatment through modern medical practices, it is just the tip of the iceberg, because we are just treating the patient, giving them medication for hypertension, least realizing what are the issues which are affecting them. There may be some marital discord, there may be some other issue which may be affecting them, which we are not aware of. So once people started connecting with me for all these reasons, I could give them one-stop treatment for everything. So not only they could just reveal everything what is happening in their life, and I could treat them in a better way, I was able to correlate and give them modern medical therapy, Ayurvedic healing, and everything in combination, and I could provide a better treatment to them. So this brings me to my next core belief, that keep moving and shed off the stereotypical or typecasted role. With medical profession, you cannot do this. Science cannot be correlated with alternative healing practices. No. Keep moving and shed off the stereotypical or typecasted role. A path is made where footsteps are left and seen. Be the path blazer. Life is too short to be lived with regrets. For me, my profession is not a business. It is with the core belief that I am working for someone that gives me so much of pleasure. And it does not matter to me whether I am treating one patient or 100 patients in a day, because for that one patient, I am the absolute healer. If I can bring change in one person's life, there are so many people associated with that person that this change will affect those people as well. So I move with the firm idea that I am just the conduit between the ultimate healer and the healed. And I am just manifesting his ideas and his wishes into reality. So this brings me to my final conclusion, that yes, I want to be a billionaire. Whosoever is sitting over this and whosoever is sitting in this room wants to be a billionaire. Do you agree with this? Yes. So I also want to be a billionaire by touching a billion hearts, by bringing a change in their lives, you included. And I want to live a life not just successful, but significant. Jai Hind and thank you.